It's never been a busier time than now in Washington when you think of cancer policy and everything that it affects the cancer ecosystem. I'm someone who always focuses on the regulatory and policy environment. So I think that is an area that we really need to take a step back and say, is it working towards allowing value-based cancer care to advance and to become and meet the promise that we've always been talking about? Our policymakers don't really understand how they stand in the way of us achieving value-based cancer care and that sort of true dream and hope of where the patient is getting high quality, high value cancer care, where in the setting that is right for them when they need it, without all the barriers to care that our system tends to throw into their way. So policymakers really need to help us innovate and reduce some of the barriers to access and the barriers to providers and payers coming together and sort of transforming the system. I think addressing pharmacy benefit managers has the potential to really have the biggest impact for everybody in the entire cancer care ecosystem. PBMs 20 years ago were a good idea, but as a lot of things have evolved over time, they've turned into more of a problem in the system, getting between patients and their providers, impacting their ability to access the right treatment, the right time, in the right place. So I think, there are about 25 PBM reform bills right now before Congress, and that's just in this 118th Congress. There could be more to come in the future. Amongst all of those bills, all of those reform efforts, they really have the potential to make a big impact on how the cancer care experience unfolds for patients. One big area that we need Washington to look into is ERISA. That's the employee side of insurance programs and how you regulate them. That's always been a big gap in regulation and enforcement because the federal government has always been stymied in its abilities to go into that and address that and reform things like how PBMs integrate with ERISA and affect people that are covered by plans that fall under ERISA. All of us with employer-sponsored insurance are hugely impacted by the regulation and oversight that happens there, or the lack of that. It's critically important for every stakeholder in the cancer care ecosystem, from the providers to the nurses to the administrators and everyone and the patients, most importantly, to get involved in cancer policy. There are a lot of ways in which you can do that. Most simply, getting to know your local elected officials, letting them know your perspective, as well as getting involved in national organizations such as the Community Oncology Alliance, where we create lots of opportunities for stakeholders to have their voices heard and create opportunities for them to make meaningful change. Because Washington moves at a snail's pace, but when that change does happen, it affects everyone in the system, and it's not always for the better. And so you need to make sure that your perspective, what matters to you, what matters to your patients, is heard and acted upon.